Sana'y handa na ang inyong mga maiinit na kape dahil isang oras na naman na puno ng aral ang matutunghayan natin ngayon. Ako po si Dr. Catherine Faith Racho, ang inyong host mula sa Kagawaran ng Kalusugan. Sa ating mga media partners, sa mga nakasubaybay sa ating Facebook live stream at YouTube channel, magandang hapon po sa inyong lahat. Welcome to today's Kapihan with Media. Bago po tayo tuluyang magsimula, babasahin ko lang po ang ating mga house rules. To ensure the smooth flow of this session, number 1, use the naming convention for Zoom usernames to ensure proper acknowledgement. Number 2, pay attention to the discussion of our health experts and or resource persons. Number 3, keep microphones muted while speakers are discussing and presenting. Number 4, should you have questions, participants shall signify and send them in the Zoom's chat box and wait for the host to acknowledge. An open forum after the discussion. Submitted questions will be addressed first by our experts, followed by Zoom chat box questions. Every participant is advised to reserve questions. Only questions related to the topic discussed will be entertained. Join the meeting until the last part of the session. Sa dami ng lumalaganap na sakit at impeksyon ngayon, sadyang napapanahon na nga naman ang ating pag-ausap ngayong kapihan, ang National Infection Prevention and Control Week na idinaraos tuwing ikalawang linggo ng Hulyo. Para bigyan tayo ng dagdag na kaalaman tungkol sa usaping ito, kasama natin ngayon si Dr. Charmaine Luis Lozada, Medical Officer 3, ng Health Facility Development Bureau ng DOH. She is also the National Infection Prevention and Control Program Manager. Dr. The floor is all yours po.
Okay. So thank you very much for that introduction and hello to everyone watching us today. Good afternoon po sa inyong lahat. I'm Dr. Charmaine Lozada from the Health Facility Development Bureau of the DOH. And today, I'd like to present to you about the National Infection Prevention and Control Program. Yeah. Okay. So next slide, please. All right. So to start, the National Infection Prevention and Control Program is lodged under the Health Facility Development Bureau, which has the following mandates: to develop policies, plans, programs, projects, and strategies related to health facility development, planning, operation, and maintenance. And second, to provide coordination, technical assistance, capacity building, and consultation and advisory services. Next slide, please. All right. So here, I'd like to share with you the mission and vision of the DOH Infection Prevention and Control Program. So for the mission, the National Infection Prevention and Control Program leads health facilities in preventing patients and health workers from being harmed by avoidable infections through policy development, capacity building, and collaborative initiatives. The program is guided by technical experts and evidence-based strategies working towards addressing the burden of healthcare-associated infections and antimicrobial resistance and achieving universal healthcare in the Philippines. Meanwhile, for the vision of the program, it envisions itself that by 2028, the program aims to institutionalize infection prevention and control in every health facility, protecting all patients and health workers from avoidable infections. Okay, so as mentioned, one of the main priorities of the National IPC program is healthcare-associated infections, or HAI. So next slide, please. So speaking of that, what is an HAI? No, let's define what it is. So according to the World Health Organization, healthcare-associated infections, or HAI, is an infection occurring in a patient during the process of care in a hospital or other healthcare facility which is not present at the time of admission. The most common infections associated with healthcare facilities include catheter-associated urinary tract infections, central line-associated bloodstream infections, surgical site infections, and pneumonia. Next slide, please. All right. So why are we talking about HAIs? No? Why is it important? So first, healthcare-associated infections represent a major burden of disease for patients all over the world. Second, it can be prevented through effective infection prevention and control practices and interventions. And lastly, it is also one of the WHO core components of IPC, and it's also a priority area for the DOH National IPC program. Next, please. So as mentioned, HAIs can be prevented by IPC practices. No, one such practice is hand hygiene. All right. So one of the standard precautions that we implement as part of infection prevention and control in health facilities is the 5 moments of hand hygiene pictured here. The first moment of hand hygiene is before touching a patient. The second is before a clean or aseptic procedure. The third is after body fluid exposure risk and after glove removal. The fourth moment of hand hygiene is after touching a patient. And the fifth moment of hand hygiene is after touching the patient's surroundings. So as we can see here, moments 1 and 2 are done to protect the patient against harmful germs that may be carried by your hands. While moments 3, 4, and 5 are done to protect yourself and the healthcare environment from harmful patient germs. Okay, so hand hygiene is a simple and low cost yet effective measure to prevent healthcare associated infections or HAI. Next slide, please. Okay, so given the significance of HAI, this was the center of our theme for this year's celebration of the National Infection Prevention and Control Week, which we have themed Beyond the Pandemic, HAI, highlighting the importance of IPC. So this celebration is pursuant to Proclamation number 971, series of 2020, declaring the second week of July of every year as National Infection Prevention and Control Week, and also the second Saturday of July of every year as the Surgical Infection Prevention Awareness Day. So since this proclamation, the Department of Health has led the celebration annually by selecting the theme and prescribed activities together with IPC societies. The chosen theme aims to raise awareness on healthcare-associated infections and promote activities and initiatives on HAI surveillance. Next slide, please. All right. So as part of the celebration of National Infection Prevention and Control Week, various activities were conducted by the Department of Health through the Centers for Health Development, in which health facilities all over the country participated in. So pictured here are some of our social media cards that we shared during the event, and some samples of the activities conducted by the regions. No, so the activities included photojournalism contests, TikTok challenges, poster making contests, and informational Facebook live streams. Next slide, please. Okay, so in the Department of Health, what are we doing to fight healthcare-associated infections? Okay, so first, we are developing a national policy on healthcare-associated infection surveillance for all health facilities. And second, we are also conducting research on the baseline rates and prevalence of these HAIs in our health facilities. Next slide, please. Okay, so at this point, I'd like to talk about what else has been accomplished by the National IPC program. So in support of our goal to reduce the risk of healthcare-associated infections, let me share with you some of the recent milestones of the National IPC program. Next slide, please. Okay, so in 2020, the Infection Prevention and Control Program was at the forefront of the COVID-19 pandemic response. It has exercised its mandate to provide technical guidance through policy development in relation to IPC. Throughout the pandemic, the program has crafted more than 36 policies to help our health facilities respond to the needs at the front lines. Moreover, the IPC program was also involved in monitoring clustering in health facilities as part of its strategy to mitigate infections among healthcare workers through the conduct of root cause analysis and provision of technical assistance. In coordination with our development partners, the Department of Health has also created training materials and conducted training of trainers to ensure that the policies are disseminated to everyone. Next slide, please. Okay. And then in 2021, the Department of Health updated and released the third edition of the National Manual of Standards in Infection Prevention and Control for Health Facilities. This manual contains 8 chapters which correspond to the WHO core components of an effective IPC program. These 8 components are: number 1, an IPC program; Number 2, IPC guidelines. 3, IPC education and training. Number 4, healthcare-associated infection surveillance. Number 5, multimodal strategies. Number 6, monitoring, audit, and feedback. Number 7, workload, staffing, and bed occupancy at the facility level. And lastly, number 8, built environment, materials, and equipment for IPC. Furthermore, this manual provides the minimum requirements for an effective IPC program in every health facility. And this also helps to provide guidance to stakeholders in integrating infection prevention and control into all levels of healthcare service delivery. Next slide, please. Also, in the same year, in line with the implementation of the Philippine Health Facility Development Plan, the Health Facility Profiling System was established. The Health Facility Profiling System enables the identification of gaps in health facilities towards the system-wide strengthening of health facility networks. One of the modules included in this online system is the Infection Prevention and Control Assessment Tool, which is used to assess health facilities' compliance to IPC standards and core components. Next slide, please. Okay, so here's some data gathered from the Health Facility Profiling System. So IPC programs require human resources and governance structures. The IPC committee is responsible for policy direction at the facility level, while the IPC unit is responsible for day-to-day operations of the hospital or the health facility. However, there are still some health facilities, even tertiary level hospitals, who do not have an established IPC committee or IPC unit yet. To address this, the national standards for infection prevention and control require that every hospital have an IPC committee and an IPC unit. And we also provide guidelines for establishing these. For national government hospitals, the staffing pattern has also been revised to provide for human resources for health. Next slide, please. Okay, so in relation to healthcare-associated infections, we have more data here from gathered through our health facility profiling system. So the first graph shows that a significant number of hospitals still do not have a surveillance process for healthcare-associated infections in place. The second graph again shows inadequate staffing due to lack of human resources. More than a third of health facilities do not have a dedicated surveillance officer. On the ground, infection prevention and control staff may be overworked and have multiple assigned roles aside from being a dedicated surveillance officer. So to address these gaps also, the National IPC program is establishing a national policy on hospital-acquired infection surveillance, as mentioned, with standardized definitions, processes, and appropriate staffing standards. Next slide, please. Okay. And then in 2022, the National Policy on Infection Prevention and Control was revised. The revision of this administrative order was precipitated by the need to align with the WHO 8 core components of IPC. These core components are vital in the effective and efficient implementation of IPC programs in all health facilities in the country. Further, the framework and provisions of this order are anchored on the National Standards in Infection Prevention and Control for Health Facilities, 3rd edition. This issuance aims to improve health service delivery by focusing on sustainable, manageable, and critical interventions that optimize available resources, supported by evidence and sufficient groundwork for IPC. Next slide, please. All right. So also in 2022, the Philippines, represented by the Department of Health, participated in the 75th World Health Assembly and was involved in the strategic direction setting of the Global Strategy on Infection Prevention and Control. The Philippines is signatory to the WHO Global Commitment to IPC, where member states endorsed the Global Strategy on Infection Prevention and Control on May 28, 2022. Committing to the development of a global strategy and associated action plan with targets to be achieved by 2030. Next slide, please. Okay. So this is the global strategy on IPC from the WHO, which the national DOH program aligns itself with. So this strategy focuses on 3 main areas, summarized by the slogan Prevent, Act, and Coordinate. So the first strategy is to prevent infection in healthcare. The objective of this is to substantially improve healthcare quality and safety by reducing the frequency of infection and AMR, antimicrobial resistance, acquired during healthcare delivery and their burden on those who access and provide healthcare, including in the context of health emergencies. The second strategy is to act to ensure IPC programs are in place and implemented. So this aims to provide strategic directions and catalyze political commitment to enable active IPC programs for HAI and AMR reduction and prevention and control of outbreaks. And lastly, the third strategy is to coordinate IPC activities with other areas and sectors and vice versa. So this aims to transform healthcare systems and service delivery in such a way that IPC is implemented in clinical practice and within an enabling environment through WASH or water and sanitation in health, and coordinating with public health emergencies, universal health coverage, patient safety, quality of care, AMR, occupational health, health promotion, immunization, biosafety and biosecurity, and other public health related programs. Next slide, please. And then in late 2022, last year, to set the direction for the National Infection Prevention and Control Program, the strategic plan for 2023 to 2028 was drafted by the Health Facility Development Bureau together with key stakeholders such as professional IPC societies, including FIX and FICNA. The FIX is the Philippine Hospital Infection Control Society, and FICNA is the Philippine Hospital of Infection Control Nurses Association. Also included during the planning of this was the WHO Western Pacific Regional Office and the WHO Philippines Country Office. Also included were the Epidemiology Bureau for HAI surveillance, the National Antimicrobial Stewardship Program, in the Office for Health Laboratories, and representatives from infectious disease specialty hospitals and IPC unit staff. Next slide, please. All right. And then most recently, in 2023, the Department of Health joined the first meeting of the ASEAN US-CDC Infection Prevention and Control Task Force. During this meeting, the Department of Health of the Philippines shared its experiences in implementing the national IPC program. Discussions and planning of priority task force activities for the region was also conducted. Next slide, please. All right. So before I end, I would like to congratulate all the Centers for Health Development for successfully leading the celebration of the National Infection Prevention and Control Week in their respective regions in the past week. I would also like to thank all the health facilities for their efforts in conducting various activities, and for all our hardworking infection prevention and control healthcare workers for their active participation in the national celebration. So together, let's protect all patients and healthcare workers from avoidable infections. Thank you very much.
Okay, maraming salamat po, Dr. Charmaine. Sobrang importante talaga na may program na nakatutok sa pagpigil ng paglaganap ng infection, not only to the vulnerable population. So magtungo naman po tayo sa ating Q&A portion po.
Okay.
Una, ano ang pinakasimple at pinakamabisang paraan para maiwasan ang infection?
Okay. All right. So, sige. So, para maiwasan natin ang mga infection, meron po tayong tinatawag na mga standard precautions, no? And then, ang mga ito ay ang mga minimum standard practices na naglalayong protektahan ang mga healthcare worker at pasyente laban sa mga nakakahawang sakit. So, ang isang halimbawa ng standard precautions na ito ay ang hand hygiene na natalakay natin kanina, no? So, ang halimbawa nito ay ang paghuhugas gamit ang sabon at tubig, o kung hindi available ang soap and water, pwede naman po gumamit ng hand sanitizer, alcohol-based hand rub, as long as the hands are not visibly soiled. And then, ang hand hygiene na ito ay napaka-importante dahil ito ay napaka-simpleng solusyon ngunit epektibong paraan para maiwasan natin ang mga infection.
Yes, tama. Hindi naman kailangan gumastos kasi
Mm.
readily accessible naman ang water.
Yes.
Okay, and then next po, at par nga with preventing the spread of infection ay ang wastong pagtapon ng mga medical waste sa mga health facilities. Anong measures po ba ang ginagawa ng DOH to ensure proper and effective medical waste management?
Okay. So with regards to healthcare waste management, no, we also have under the Health Facility Development Bureau a healthcare waste management program. And under this program, the program also has its own manual, and it develops policies, also cascades these policies to the regions and the health facilities, and also conducts training with regards to this. And one of the key components of healthcare waste management in health facilities is the waste audit. No? So it's an activity that the health facilities conduct, supervised by our regional offices and the central office as well, to validate the proper segregation of wastes, safe handling, treatment, and disposal based on the waste types and hazard levels. So also included in our manual of standards for infection prevention and control, there's a section there that talks about healthcare waste management that says that health facilities have to appropriately label bins to allow for healthcare waste segregation. So, for example, what we see in hospitals and other healthcare settings, we have yellow trash bins for infectious waste, and we also have dedicated trash receptacles for sharps, needles, those kinds of things to also promote patient safety.
Yes, importante talaga ang labeling and segregation. Tapos dahil nasa usapin naman tayo ng infection, I'm sure in your practice as a doctor, may mga encounters ka din tulad ng itong pangatlong tanong ko. Tama po ba talaga yung ginagawang practice na ang antibiotic, tinatanggal siya sa loob ng kanyang capsule tapos ibinubudbod mismo sa sugat imbes na ito ay inumin?
Yes, okay.
Naku, madaming gumagawa yan talaga.
I know, oo.
So once and for
malaking,
all, ito na. This is the chance.
oo. So, no, hindi po ito tamang gawin, no?
Yes.
So, oo, may mga tinatawag po tayong medication safety rules, no? So, for example, kailangan right drug, tamang gamot, right time, tamang oras, right dose, tamang dosage, at right route of administration. Or kung paano binibigay yung gamot. At lahat naman ng ito ay kung resetahan po tayo ng antibiotic ay nakalagay po sa reseta with instructions from our healthcare provider, no? So napaka-importante na sundin natin yung dosage, yung oras ng pag-inom, tsaka kung ano nakalagay doon, kung oral or kung binigyan kayo ng topical, yung mga ointment, for example, sundin po natin kung ano po yung advice sa atin ng ating healthcare provider, no? Because ang napaka-importanting issue na kaakibat nito ay ang AMR or antimicrobial resistance, no? O ito yung kakayanan ng mikrobyo na protektahan ang kanilang sarili laban sa mga antimicrobials o yung mga gamot natin para sa infeksyon. So, oo, yung gusto nating iwasan ay yung dumating yung panahon na pag magka-impeksyon yung tao, hindi na natin siya magagamot dahil nawawala na ng bisa at humihina yung lahat ng mga gamot na meron tayo ngayon.
Yes.
So, kaya po napaka-importante nun.
Yes, thank you po, Doctor, for clearing that out kasi for sure madami sa ating mga kapwa Pinoy ay may mga gumagawa talaga ng ganung practice. So, maraming salamat po, Doctor, sa lahat ng iyong mga information na in-announce ngayon. At gusto ko lang malaman kung may mga takeaway messages po ba tayo?
Okay. So, siguro, since just to siguro take this opportunity, no, now that we have the COVID-19 pandemic under control, for the infection prevention control field, it's time for us to we now shift our focus to other important issues, no, in IPC, no. So one of those is yung healthcare associated infections nga, that was the theme of our recent IPC week celebration. So usually this is a concern in the healthcare setting, no, sa mga hospitals. So this is most important to our healthcare workers and also to patients. So siguro sa publiko or kung merong mga mamamayan na nanonood sa atin ngayon, pag kayo po ay nasa healthcare setting, kahit sa doctor's clinic lang, hindi naka-admit, importante pa rin po yung pinaka-basic ay hand hygiene. Kung ang mga sakit naman po halimbawa ay COVID or tuberculosis na respiratory in origin, yung masispread sa ating pag-ubo halimbawa, importante na may cough etiquette tayo, yung we cover our mouths when we cough or we wear a mask, no? Kasi yun yung mga ilang bagay na makaka-prevent po na ating mga healthcare-associated infections. And then siguro, again, it was a very successful celebration of IPC Week last week. All the regions were very active and the health facilities, the hospitals. So again, I just like to thank them for their active participation.
Yes, okay. Thank you po, Doc Charm. So, congratulations po sa lahat ng bumubuo ng National Infection Prevention and Control sa inyong successful celebration recently. So, gaya nga po ng sinabi ni Doc Charm, minimum standard, maghugas lagi ng kamay. At hindi lang yung bare minimum na as in maghugas, pero like yung sinasabi na 20 seconds na naghuhugas talaga properly ng kamay, pati yung nooks and crevices, kailangan talaga ay gawin para hindi lang natin napoprotektahan kasi yung sarili natin, kundi pati yung mga mahal natin sa buhay.
Yes.
Okay. So thank you so much, Doc Charm, sa oras na binigay nyo at sa lahat ng kaalamang ibinahagi nyo ngayon sa ating Kapihan session. Para naman sa ating mga kaibigan sa media, maraming salamat for partnering with us to ensure timely, relevant, and truthful information sa ating mga kapwa Pilipino pagdating sa usaping pangkalusugan. Muli, ako po si Dr. Catherine Racho mula sa Kagawaran ng Kalusugan. Magkita-kita po tayong muli sa susunod na Kapihan with Media. Sama-sama po tayo sa isang healthy Pilipinas. Thank you.